Welcome to the Healthy Workplace Participatory Program orientation. This video will provide an orientation to the program for new or returning users. By the end of this video, we anticipate that viewers will understand the concept of total worker health, become familiarized with the Healthy Workplace Participatory Program, or HWPP, a tool for implementing total worker health, and understand your role in implementing the HWPP in your workplace. Often, worker safety, health, and well-being programs exist separately in a siloed, top-down approach that can lead to fragmented efforts across departments that overlooks interconnected factors and worker knowledge. Safety and health concerns are complex, and worker input is needed to understand problems and to create solutions that work. In the next slide, we'll learn about the integrative total worker health approach and how it can be used to enhance worker safety, health, and well-being. The National Institute for Occupational Safety and Health, or NIOSH, defines total worker health as policies, programs, and practices that integrate protection from work-related safety and health hazards with injury and illness prevention efforts to advance worker well-being. Total worker health is a holistic approach to worker well-being. As the image shows, workers in the center are affected by working conditions, the conditions outside of work, and their own personal characteristics. The organization of work has an effect on all of these dimensions. This image represents the concept of total worker health and how worker safety and well-being is impacted by overlapping influences such as the home and community environment, personal health behaviors, and workplace environment. Research has shown that worker participation in total worker health programming results in short-term benefits like increased morale and job satisfaction, and long-term benefits like decreased worker injuries and accidents. Fundamentals of a total worker health approach include leadership commitment to worker safety and health, prioritizing a hazard-free work environment by designing work to eliminate or reduce safety and health hazards, worker engagement in the identification of hazards and design and implementation of the program, ensuring confidentiality when collecting worker health data, and by taking a systems-level approach. This chart shows examples of occupational illness and injury issues and how they might be addressed using a total worker health approach. In the first example, for workers exposed to a respiratory hazard that could result in lung disease, we use engineering controls for respiratory protection plus a tobacco cessation program. We do this because workers who smoke are more susceptible to develop the disease. In this scenario, the safety program and the health promotion program set joint goals for lung health and work together to integrate their program activities. The HWPP is a worker-led approach with two core elements: the two-committee structure and the intervention, design, and analysis scorecard tool called the IDEAS Toolkit. The two-committee structure engages senior leaders and frontline workers in a design process to address worker health, safety, and well-being, helping to develop a shared sense of commitment to addressing and solving workplace concerns. In the next slides, you will learn about the roles and responsibilities of each participant role. This image illustrates the first of two core elements of the Healthy Workplace Participatory Program, the two-committee structure. It highlights how the two-committee structure results in a participatory program where information is shared, teamwork is encouraged, and feedback is provided at all levels. The second core element of the HWPP is the Intervention, Design, and Analysis Toolkit. This process uses concepts of continuous improvement and business case planning to produce workable solutions that are in line with resources and strategic goals. The HWPP explicitly focuses on employee engagement as the core innovation. It accomplishes that by giving workers specific roles throughout all phases of the program. The role of the steering committee is to allocate and coordinate resources, make strategic decisions, and promote the work of the design team. The steering committee consists of senior leaders or members of management that have the ability to make policy and budget decisions. The steering committee collaborates with the design team in identifying data-driven health, safety, and well-being concerns, setting selection criteria, choosing interventions to implement, creating a plan for implementation, and evaluation of chosen interventions. Within the steering committee, there is an important role called the program champion. The champion is typically a senior leader that helps to secure resources for the design team, leads the steering committee, and promotes the program to the whole organization. The champion should schedule regular check-in meetings with the co-facilitators to monitor design team progress and help the co-facilitators address any obstacles that may arise. The role of the design team is to uncover the root causes of worker health, safety, and well-being concerns and design interventions to eliminate or reduce the hazards. Ideally, the design team will meet bi-weekly to design interventions using the HWPP. The design team should be a diverse, multidisciplinary group of frontline workers with a commitment to creating a healthy and safe workplace. It is also important that there are no direct supervisory relationships in the design team to ensure that all members feel comfortable sharing openly. The design team is led by 1 to 2 facilitators that are responsible for facilitating the design team through the Ideas Toolkit activities. The facilitators should have no supervisory responsibilities over any design team members. Facilitators should be prepared to facilitate meetings and help the group work through moments of disagreement that may arise. The facilitators also act like a liaison between the steering committee and the design team and should plan to meet regularly with the steering committee champion to provide updates on design team progress and for assistance in the design team securing resources and overcoming obstacles to design team participation. When implementing the HWPP in a workplace, there are free resources and training available on the Center for the Promotion of Health in the New England Workplace or CPH-NEW website. Participants have reported many benefits to taking part in the HWPP. These include skill building in areas like leadership skills, meeting facilitation, networking with other departments across an organization, creating change for a healthier and safer work environment, and having fun while implementing worker-informed solutions. Thank you for watching this orientation of the Healthy Workplace Participatory Program. This video can be used to gain a better understanding of the program before implementation. It can also be a tool for existing users to orient their workforce or new steering committee or design team members. By implementing a total worker health program using the HWPP, organizations can effectively engage both leaders and workers in a collaborative effort to enhance health, safety, and well-being across the workplace.